Did you know that nearly 50% of people living with HIV experience mental health issues like depression and anxiety? This staggering statistic highlights an often overlooked crisis within the HIV/AIDS community that desperately needs more attention. Today, we're diving into an important but frequently neglected topic: the mental health challenges faced by people living with HIV/AIDS. While significant strides have been made in the medical treatment of HIV, the mental health crisis that accompanies this condition is often pushed to the background. However, mental health is a crucial aspect of overall well-being, especially for those living with a chronic illness like HIV. In this video, we'll explore why mental health challenges are so prevalent in the HIV/AIDS community, the impact they have on individuals, and why it's essential to address these issues with the same urgency as physical health. Living with HIV/AIDS is more than just a physical health challenge. It's a mental and emotional battle as well. The stigma surrounding HIV is still pervasive, leading to feelings of isolation and fear. Many individuals with HIV struggle with anxiety, constantly worrying about their health, how others perceive them, and the long-term implications of their diagnosis. Depression is also common, often triggered by the overwhelming reality of living with a chronic condition that requires lifelong management. The social stigma attached to HIV can exacerbate these feelings, leading to further isolation and despair. In addition to anxiety and depression, people living with HIV may face other mental health challenges such as post-traumatic stress disorder, PTSD, especially if their diagnosis was the result of a traumatic event. Substance abuse is another concern, as some individuals may turn to drugs or alcohol as a coping mechanism. All of these issues are interconnected, creating a cycle of mental health struggles that can be difficult to break. Unfortunately, these challenges are often underdiagnosed and untreated, leaving individuals without the support they need to manage both their mental and physical health effectively. The intersection of mental health and HIV/AIDS is complex and multifaceted. Discrimination remains a significant factor contributing to the mental health struggles of people with HIV. Despite advances in treatment and public awareness, HIV-related stigma persists in many communities. This stigma can manifest in various ways, from subtle biases to outright discrimination, making it difficult for individuals to disclose their status, seek support, or access the care they need. This discrimination is not only harmful to mental health, but also acts as a barrier to accessing quality health care, which is essential for managing HIV effectively. Healthcare access itself is another critical issue. While antiretroviral therapy, ART, has transformed HIV from a fatal diagnosis to a manageable chronic condition, access to mental health care remains limited for many. In some areas, there is a lack of mental health professionals who are knowledgeable about the unique needs of people with HIV. This gap in care can lead to untreated mental health conditions, which can worsen physical health outcomes. For example, depression can negatively impact adherence to ART, leading to poorer health outcomes and a higher risk of HIV transmission. The impact of an HIV diagnosis on mental well-being cannot be overstated. Receiving an HIV diagnosis is a life-changing event that can trigger a wide range of emotional responses. Some individuals may experience shock, denial, or anger, while others may feel overwhelming sadness or hopelessness. The initial diagnosis is often just the beginning of a long journey that involves coming to terms with the condition, managing ongoing medical care, and navigating the social and emotional challenges that come with living with HIV. The fear of disclosure is another significant mental health challenge for people living with HIV. Disclosing one's HIV status can be a daunting task, as it opens up the possibility of rejection, discrimination, and even violence in some cases. This fear can lead to social withdrawal and a reluctance to seek out relationships or support networks, further exacerbating feelings of loneliness and isolation. The stress of managing when, how, and to whom to disclose can also contribute to anxiety and depression. Substance abuse is another critical issue in the intersection of HIV and mental health. Some individuals may use drugs or alcohol as a way to cope with the emotional pain of living with HIV. While this may provide temporary relief, it often leads to a vicious cycle of addiction, poor mental health, and physical health complications. Substance abuse can also interfere with the effectiveness of HIV treatment, leading to poorer health outcomes and a decreased quality of life. It's also important to consider the role of social support in mental health. Having a strong support network can make a significant difference in the mental well-being of people living with HIV. Support groups, whether in person or online, provide a safe space for individuals to share their experiences, receive emotional support, and learn from others who are going through similar challenges. Unfortunately, many people with HIV feel isolated and may not have access to these kinds of support systems, making it even more crucial to address mental health as part of comprehensive HIV care. Let's consider the story of David, a 34-year-old man who was diagnosed with HIV 5 years ago. When David first received his diagnosis, he was overwhelmed with fear and shame. He didn't know how to tell his family or friends, and he struggled with feelings of worthlessness and despair. As his mental health declined, he began missing his art doses, which led to a deterioration in his physical health. Eventually, David sought help from a mental health professional who specialized in working with people living with HIV. Through therapy, he was able to address his feelings of shame and fear, rebuild his self-esteem, and develop a plan for managing his health. David also joined a support group where he found a community of people who understood what he was going through. Today, David is healthier than ever, both physically and mentally, and he credits his recovery to the mental health support he received. In summary, mental health challenges are a significant but often overlooked aspect of living with HIV/AIDS. From anxiety and depression to the effects of stigma and discrimination, these challenges can have a profound impact on individuals' overall well-being and their ability to manage their condition. It's crucial that mental health support becomes a standard part of HIV care, ensuring that people living with HIV have the resources they need to lead healthy, fulfilling lives. As we've seen through David's story, addressing mental health can be transformative, offering a path to both emotional and physical recovery. What are your thoughts on the mental health challenges faced by people living with HIV? Have you or someone you know been affected by these issues? Share your experiences in the comments below. And if you're interested in learning more about mental health awareness, be sure to subscribe and check out our next video on strategies for managing mental health in chronic illness.